Good evening. Thank you. Thank you for joining our workshop. And tonight we have a presentation. If both of you could introduce yourselves and then please proceed.
So good evening, and thank you for having us, to all the councilors and Mr. Mayor. What we're here for today is to talk about Project Support You. Currently, our department has 1.5 or 1.5 Project Support You workers. They are mental health caseworkers. In addition to our options caseworker, which is Dave Bilodeau behind me. They'll all go and introduce themselves, but I'll briefly tell you who's at the table. So Catherine Ryder here is the Chief Executive Officer for Tri-County Mental Health, and Joe Philippon is a detective with our agency. He's been instrumental throughout the project of Project Support You. So what we're looking for is, at some point, we'd like to increase our services instead of having just 1.5 Project Support You workers that ride along with our police officers and deal with mental health issues, homelessness, and a whole gamut to include substance misuse disorder. We'd like to have 2 full-time positions instead of 1.5. So as it stands right now, we have 1 Project Support You worker that works during the daytime full-time, and the second worker comes in and works the evening, but she's only part-time. So with that said, I'll turn it over to Catherine.
Good evening. I'm Catherine Ryder once again, and I will share with you that I have been working in this community for 30 years this year at Tri-County Mental Health Services. Came in as a clinician 30 years ago and have been serving as the CEO for the past 12. I've had the great privilege of working with our local law enforcement and 12 of our larger community service organizations over the past half a dozen years, building programs that lead to a recovery-ready community to address the substance use crisis across our communities of Lewiston, Auburn. And in that period of time, Detective Philippon, who was part of our law enforcement subcommittee, advocated several times for us to be boots on the ground out in the community, meeting people where they were at, because we knew there was a population of individuals that would probably never cross the threshold of our agency to ask for services, and that we needed to be out where they were and potentially corresponding with law enforcement, which we have been successful in doing. And you can't hear me. That's okay. Sorry about that. I could hear myself. So you have in front of you a package that I have put together that includes a narrative that will tell you about the program, and you will see that it is based on an evidence-based program that is included at SAMHSA, which is Substance Abuse Mental Health Services of America. Evidence-based means that it has been studied over a period of years and found to produce excellent outcomes. Our program has only been up and running for close to 2 years, so we don't have that level of evidence yet, but I would like to show you what we are learning here in the greater Lewiston community. So I will move on to our next slide. This particular graph, and you have this in your packet as well, has 4 lines. The top line, which is the bright red line, will show you that from May of 2019 to November of 21, we have been tracking the total number of overdoses in the Lewiston community. So again, the red line at the top, you can see back in May of 2019, there were 10, and then you will see spikes here. So this is August of 21, and it's not reading out, but I can tell you that that number is 58. So we have seen a significant increase in the number of overdoses. I'm sure you've been following the news. You know that we had 636 overdose deaths in the state of Maine last year, which is catastrophic. The year before it was 514, the year before some 354. So the number is increasing. We are calling them the agency deaths of despair. People are, through the COVID pandemic, feel increasingly more disconnected, depressed, anxious, and the level of use has increased, and in particular, in some part because they are no longer able to come together in vivo meetings for support groups. So think about your AA meetings and your NARLON meetings, and those are all meetings where people would come together in a social context, and those disbanded during COVID. So the amount of isolation has increased. Anyways, importantly, noting those incredible spikes, the blue line following that is Narcan administrations, total Narcan administrations. And then the next line underneath that, which is also red, and I don't know why it translated to red, it was a different color on my original, is Narcan that's administered by law enforcement officers. So I would assume that the balance of those is EMS and or bystanders. And then the white line at the bottom, which I think is probably the most important line for us to be looking at, is the actual deaths resulting from overdose. And I would ask you to note that while there are small spikes in 2021, the administration of Narcan is saving lives. And that is part of the education and the use and the distribution of Narcan in the community. And what we know is that every time we are able to save a life and start a conversation, we are able to engage people in a discovery process about their readiness for treatment and their ability to contemplate resources that we can make instantly available to them. Dave Bilodeau is one of those resources, and he travels along with law enforcement in their car, as do our Project Support You folks, and they're able to be on the scene in the moment. Sometimes folks are still unconscious when they arrive at a scene. They are administered Narcan, and we hope that we're imprinting on them. So they see our faces in that moment when they're in that crisis state, and then when we are able to do follow-up, we are hopeful that they will remember us and be willing to respond as we build trust and relationship, and hopefully are then able to engage them in services. So again, just to make this a little bit clearer, in the year 2019, you will see total number of overdoses were 112. The next year, 176. The next year, 300. And that's here in Lewiston. This chart here, which is something that Chief St. Pierre and Joe have been asking me to produce for some time, and it's taken a significant amount of work with our database report writer to take the raw data that we're receiving from Lewiston Police Department and then translating it into individuals in this community. So these numbers translate to individuals that we are serving in the community, and then it will tell you year over year. Now, I have the names. You don't, because it's, as you know, PHI, and it's confidential. But on my spreadsheet, I can see who those individuals are, and I can see year over year how many overdoses they have had, and then I can break it down within the year to what month they had those overdoses and how many. We are also adding in what was their substance when they overdosed so that we will know what their drug of choice is. And then we are targeting people that have high numbers of overdoses because we know that they are at the greatest risk, and it is our goal to intervene as assertively as possible, hoping again to build trust and relationship and get them connected to services. So every time we have an opportunity for outreach, we have an opportunity to do what we call motivational interviewing. It's another evidence-based practice where we use a series of gentle questions to ask folks how their life is going. Is this what you were hoping for? Have you thought about what it could look like if? And so that's a lot of the work that our folks are doing, and they have immediate access to resources that we can plug them into. And working with several of the other organizations in the community, many of which you are, I'm sure, familiar with, the Rest Center and Angel's Wing, there are many. And Mayor Shalene is calling together a meeting of providers in the community to continue to talk about how we raise up that collaboration and improve what we're currently doing. This is in a Locks box, and we have been posting these across the community. They're let's see, we have them out at Lost Valley, we have them at Auburn Library. Gosh, Dave, help me.
We have it at Trinity Jubilee Center, Women's Wisdom Center,
Sophia's Place.
Lost Valley, because believe it or not, the ski patrol all volunteer, and they had no Narcan. Nobody ever trained them, and they had 2 overdoses last year. So we now have one at the ski patrol, and I went up and trained all the volunteer ski patrol people and supplied them with the Narcan.
And all of our staff are trained to provide those interventions. So do we have time for a very quick video? Should I keep moving through the rest of the presentation? I can come back to it. Why don't I come back to it if we have time? So these are our staff. Dave, who is sitting here. Who are you? Detective Philippon, who has been just incredible in all the work we do. Myself leading the project. Sarah Pratt. Sarah Pratt is the half-time person in Project Support You right now, doing the evening, weekend ride-along. She would be the person that if the funding for the remaining half an FTE comes through, we would move her to full-time. So she's already working in the program, and we would just expand her hours. And up at the top in the middle is Erica West. We also operate a syringe exchange program at the agency, and that's an opportunity, again, to provide people with clean needles so that we are reducing the transfer of hepatitis and HIV. And we are collecting used needles to make sure that they are not on the ground in our community as a way of avoiding accidental needle sticks for individuals who may come across them unknowingly. And then to the top right is Dr. Vinsel, and he was an emergency department physician at Central Maine Healthcare for a number of years and developed a passion for addictions medicine, went back to school to become an addiction specialist, and he is the prescriber in our opioid health home, and he is also someone who is just absolutely jazzed about going out into the community to meet people where they're at, going into their homes. He's done home visits with Dave and our manager for the program, and the people that he visited were so incredibly impressed that they engaged in treatment. They couldn't believe that a doctor actually came to them and cared enough to come to their home and have a conversation with them about the potential for recovery. So he is somebody that we will continue to deploy into the community. This is what he loves to do, and so he is part of all of the resourcing that we are able to provide to folks. You'll note Sarah has backpacks. Those are full of basic needs. Those were items that were donated to the program, and so we are able to provide folks with some basic supplies in the community health and welfare items. So I'll stop there for Q&A because I want to make sure we have an opportunity to answer questions you have, and then if we have time and you're interested, we can go back and look at the Nalox box video, which is like a 3-minute video.
Questions from the council? Councilor LaChapelle.
Thank you, Mr. Mayor. Question I'd have, you're looking to just increase from that part-timer to a full-time. Is that full-time staff always with the police department, or
Yes.
are they doing other things?
Nope, she's assigned to us full-time. Her name's Jean Thornton, and she works during the daytime for us. Her hours are typically 9 to 5. Sarah, conversely, comes in the evenings, and she starts at,
I think she's a 4 to 8, isn't she?
yeah, 4 to 8 currently, and we'd like to make it so maybe it's 4 to 11 or 4 to midnight, so it's full-time, offering more resources. Now, of course, we recognize that, police officers are being asked more and more to do things that we're not really equipped or trained to do. So I think this is a good complement for the police department. I mean, certainly, we still have our traditional police roles and, enforcing the laws and charging people with criminal activity and criminal stuff. However, we find in the states found across the country, we find that mental health, substance misuse, all of those contribute to something that the police themselves can't just handle on their own. So it's very vital, I think, and I'm very supportive of Project Support You and the Options program.
I had a personal run-in with them, or had the pleasure of working with them Friday at our location due to extenuating circumstances, and I was impressed. My question would be, so they're two-part question. One, they're 100% with the police department. So we have them for 40 hours. They're not working for you for 30 hours and then working on other projects someplace else.
No, they're fully
40 hours.
dedicated to these programs. So Dave's position is funded through the Governor Mills Initiative, so he's 100% state funded and 40 hours with law enforcement. Jean and Sarah likewise, 1.5 positions funded by Lewiston, and they are completely dedicated. The only thing they do is they come back to the office where we have a bullpen, if you will, and they're able to do coordination of services, so make referrals to other providers, do follow-up with the individuals. So once they've made a connection, they can do some outreach and follow-up independently.
Excellent. So
The normal schedule is they do an hour of coordination and 7 hours in the vehicle.
Okay.
And that's what you try and set up. Sometimes it could be an hour and a half, but, you know, sometimes half an hour. You try, we have it set up that way.
I just went from the video, the slide, that we're not paying them to do needles exchange, or we're not paying them to do, that's a separate.
Those are other
that's a
staff. We're
separate
all
entity.
working
Okay,
together,
excellent.
resourcing each
What's
other.
the
So I have a
increase in-
dedicated position for the needle exchange.
Awesome, okay.
Yep.
What's the increase in, and what are you looking for dollar amounts?
I think maybe Heather has the number, or,
We initially were talking 41. I know we had discussed perhaps getting additional state funding for that, but I don't think that's been solidified yet.
41 for
1,000
20 hours a week?
for an additional 20 hours.
For an additional 20 hours. So somebody makes $80,000 doing that?
Between the overtime and the benefits and the administration component to it, yes.
Okay, thank you.
Councilor Jelinas?
Thank you, Mayor Schlein. Thank you, Catherine, Chief St. Pierre, Joe, Dave, for the work that you've done. It's invaluable and so important. I'm very familiar, as you know, with Project Support You and commend you for this work that's being done. It's so important. Money aside for a minute, when I look at the statistics, you know, and we look at the growing amount of overdose in our community, when you think about doing a 1.5, when you look at doing a 0.5 increase from where you are now, can you speak to whether or not you think that's really going to make an impactful difference? Money aside, I just want to kind of hear your perspective about that. Yeah, Chief.
well, I've seen a lot of progress going, you know, and the officers are it's very nice to have an officer say, like, okay, I'm dealing with this call and this individual. Can I have somebody respond that has the PSY worker or the options worker with them? So, I mean, I think it's vital, and I think the more people that we have, the better it will be. We could probably have 10 workers and give them adequate work.
Right, and I wasn't questioning the vitalness of it. I totally support this 100%. I just was questioning whether or not you felt like an increase of 1.5 to 2 was significant enough to impact change.
I think so, because of the coverage that it has, you know, days and nights, and one of them even go on to the weekend. So really, there's only one day that there wouldn't be coverage.
Right. And we're on call that one day.
Okay.
And the other thing I would say to you is that we put these folks through very rigorous training. So they are trained in suicidology, they are trained in veterans' needs, they are trained in homelessness. And when you contract for these services, you get the whole agency. So not only do you get these individual folks, but as the CEO, I am actively involved in this project, and I am pulling down every resource I can find. And with 30 years of experience in this community, I can turn those resources over pretty quickly. We have a psychiatrist who is not funded through this, but we provide him as part of the support for the program. So what I'm saying to you is that you're getting the whole agency and not just these positions.
Thank you.
Councilor Scott?
Thank you. I would just like to say thank you also for this. I think this is probably one of the best things we've had in our community, and we've needed it for quite a long time. And just a question to follow up on what Councilor Jelinas was stating. I wonder if another half and filling that position to full-time is enough. And the reason I'm going down this line is I'm thinking overdoses don't happen 9 to 5, right? Overdoses happen at 3 a.m. Do we have somebody that's there at 3 a.m.? Also, you know, I'm thinking about some of our homeless situation that we have and some of the services needed in some of the encampments that we see. Is there enough time with that person to be going to those places and doing some preventative things instead of just when you're on call? And I guess that would be my question. When they're on call, are they in the car with you? Are they at the station? Are they being called when you're going into a call for service? How does that work?
So typically, our PSY workers are with an officer at all times. They listen to the radio, they're with the officer, who's obviously listening to the radio. They're familiar with all the calls for service that are going on. So if we're dealing with a homeless individual, let's say at Dufresne Park, one officer's dealing with them and could really use the help of a PSY worker. he will call the other officer and have them respond with that PSY worker who, you know, if they feel comfortable dealing with the situation, because a lot of times this uniform doesn't really fare well with people. There might be a little bit of mistrust, there might be a little bit of fear based on the uniform. So once we feel, or, you know, like if Dave says, listen, I'm comfortable if you leave me here with this gentleman, we'll leave him there alone, provided he's okay with it, you know, to make sure that they get the best services they possibly can get.
So I'm the on-call person. The way the on-call works is I'll get calls. I've got calls from former chief, I've got calls from this chief. If I'm home and it's something that can be addressed on the phone and we can set something up for the next day, that's what we do. There have been, I want to say in the last 2.5 years, 3 times where I left my house and met the officers because it's something that I could do personally to make a difference. So the amount of time that I've had to leave and come in isn't a lot. It's only 3 times in a year and a half. But, you know, those calls come in and I can suggest, hey, bring them to this place, do this. I'll make calls myself and then call back the office, hey, look, I've got, for example, when we had the shelter open, I was able to call the shelter and get somebody in right away, you know, just from using the phone while I'm sitting at home. It didn't make it to the point where I had to leave. But there have been 3 times where I've gone in, and each time, my being there, we were able to talk the guy down and get him help.
If I may?
Please proceed,
Thank
Councillor
you.
Scott.
So how many other communities around us have this kind of project going on? Anybody else besides just us in the neighborhood?
There are a variety of projects. You've probably heard of Project Hope in Scarborough, which started several years ago. Portland had someone who did similar work several years ago, and they were actually part of the model for the options program that we're participating in. But Project Support You is a little unique, and it has been held up as a model. In fact, we just got a call from the state today saying they're going to build a new program and they're going to premise it on what we've been doing here in Lewiston. So they've been very pleased with the results of this. And we have a couple of other things in the hopper that we're hoping are going to come out on the other side. We're very interested in going mobile, and we have gone out to the encampments, and there's a whole lot more work that needs to happen out there. But there's not an opportunity in the current work to be doing that on a targeted basis. So we would really like to be able to put a medical team onto a mobile unit and be able to deploy out more frequently.
The reason I'm asking some of these questions, and I understand that there's a monetary value to this, right? There's a budgetary process to this. But we also, just a couple of weeks ago in our first meeting, had a workshop from the DA and the chief about, you know, thinking outside the box and some of the difficulties we are having with some of our folks and when there's an arrest done and going through the process. And if this is something that is going to help with that, I think it's something we seriously need to consider because it may help address some of the other issues we're having in the community. If we can address some of these issues first, this way, in a helpful way, we may not have as many arrests or many of some of the other issues that we're seeing happening in the community. So I think this is really a great thing, and I would like to see this continue. I'd also ask do we ever have to use our services, or does Auburn ever call to say, we could use your help in this person, and we help out in that respect also?
So with the options program, I work with every police department in Lewiston County.
Right.
So I'm in Auburn quite often, I'm in Lisbon quite often, Mechanic Falls, Livermore. So they call. I can tell you that they are trying to get their own PSY worker. They're trying to set up in the budget to get something like that because they've seen what's happened here. Matter of fact, Brunswick's trying to get the same program up and running in Brunswick based on what they've seen happening here in Lewiston. So our people don't go and help Auburn PSY people, but I do as part of options.
But you're funded through the state and not through the city of Lewiston,
Yeah.
correct?
That's right.
That's what I was curious about.
And even though I'm funded just through options, I'm supposed to do just the substance misuse. If I'm with an officer like happened today and we get a mental health call for somebody who's suicidal, I go in and I do it. And the state knows it, and the state's okay with it because you can't say no, I'm not going to help you. You do what you can do. Though I'm supposed to focus mainly on the substance misuse. But I started the PSY, I was the first worker, so I'm still there doing it.
Thank you.
And to be clear, the PSY position is not just addressing substance misuse. It's addressing any kind of mental health presentation. So if there are folks that are out on the street and they are clearly unwell, we can address that. Homelessness, there's not a lot of shelter to be had in the state of Maine, so that is an issue in terms of a resource that's not available, but we do our best to get people into a safe space.
Sorry.
Councilor Scott.
I'm sorry, that made me think of another question. So in the homeless situation, is that just Lewiston residents that are homeless? Or do we sometimes bring in from out of the city homeless? Because we have the services here available.
So we don't bring anyone in.
Okay.
But if there is somebody here, and I will tell you that the population moves a lot. So we have relationships with the other options workers statewide because we know that folks are going to migrate from one community to another, and that is not uncommon. So when they're in our community, we serve them because they're basically homeless.
Right. Thank you.
We still have a few minutes. I would like to see the video, please.
You would? Okay.
Sorry.
Every day, an average of 130 people die from an opioid overdose.
It's not?
Opioid overdose is the leading cause of death among adults 50 and younger in the United
Where's
States.
our IT guy?
The Locksbox helps save the
It's on
lives
the
of overdose
screen.
victims, and there are now over 600 units installed nationwide, but we can do better.
Naloxbox started
can
as a
turn this
response
around.
to a local epidemic here in Rhode Island, and since that time has expanded to a nationwide solution. By partnering with Amos House through the Rhode Island Disaster Medical Assistance Team, we've been able to get life-saving Naloxbox units into more than 20 states. Each unit increases access to naloxone, it reduces the stigma that's often associated with opioid overdose, and it works to save lives one box at a time.
Through this collaboration with Amos House and its Carpentry and Job Skills Training Program, we provide jobs to Rhode Islanders and support community-based programs. These offer much-needed services to people who use drugs, those who are experiencing homelessness, and those who are active in recovery, all while working to reduce overdose deaths nationwide.
We hate that there are so many places in this country that need Naloxbox units, but the truth of the matter is there are still so many more that need them. Although rescue should not be the only strategy used to address this epidemic, it remains a very important one. Our mission is to increase access to publicly available overdose response tools to increase the capacity of bystander rescuers to save lives. As an Naloxbox collaborator, you have the chance to save lives. You have the chance to improve victim outcomes and the chance to reduce overdose deaths. Whether you're in the private or public sector, you can make a statement that you care. You can install a Naloxbox and you can help us save lives.
So just to add to this, we purchase these at our own expense, and we install them as well, and we provide the training and the Narcan supplies. So there would be no expense to the city of Lewiston if this is something that could happen, though I understand that there are some challenges in terms of the Maine municipal associations that would need to be ironed out. But we have put these up in several places, and they are wired in, so they have an alarm that sounds when someone pulls the box that lets people know that there's someone having an overdose, all hands on deck, someone calls 911, somebody intervenes. And for those of you who may not know, if you administer Narcan and somebody isn't actually having an overdose, say, for example, they are having a heart attack, it will do no harm. So it's completely harmless.
Kennebunk is up to,
We have a councilor question.
Yeah. Councilor McCarthy.
Hard name to remember. I'm just amazed that this is such a limited program throughout the state. I mean, listening to you talk about it, it's needed all over. And to think that we're looking to go from 1.5 to 2 people in a city of 30-some-odd thousand, I think we need to get on our legislators and get a statewide program and get this expanded, because I think it does great work and I think it's really, really needed.
Thank you.
Councilor Pease.
Excuse me. How expensive are these boxes?
Oh, Lord, they're about, I spent 3,000. They're about $400 a piece because they're electronically wired in for the alarm. And inside of it, if you open it, there is Narcan, there's a rescue mask, and there is something else in there too. I can't remember exactly what. But we send our facilities staff out and they can install it. Dave does the training. We will provide new supplies of Narcan every 6 months because it does have an expiration date.
Councilor LaChapelle?
Yes.
Chief St. Pierre, you've heard 3 counselors so far look at you and say, Dave, can we give you more money? You sure 2 is enough? If we said, let's put 4, where are you, 2's going to be enough? Would 3 help? Where?
Well, here's a small issue. I mean, 4 would certainly be better than 2. 3 would be better than 2. 5 would be even better than 4. But what I'm looking at is obviously we have these people riding with police officers. So in addition to police officers, like right now we have 4 field training officers that are working the road. So all of those 4 officers have to be with another officer. So now I have 4, and typically they're all on the evening shift because they learn more on the evening shift. So right now I have 4 people being trained on night shift. So when Sarah is working, Sarah Pratt, she's the 5th person that's riding with somebody some nights. So sometimes I just don't have an officer to accompany them. I think it would make it a little bit easier or better if they had their own transportation, but that's another story and more funding, I think. Dave has his own vehicle that he uses, but he usually gets picked up by a police officer, and the PSY workers are always with the police officers. So to answer your question, yes, I think we could do better and do more if we had more people riding, but officers get tied up on calls too, so they can't always be with that person that's riding with them. So there is that difficulty.
The other thing you might consider is there's another model that's an evidence-based practice called the CAHOOTS model, CAHOOTS. And it is just working magic, and it's pairing these folks with EMS. So EMS and law enforcement going out in different ways for different things. When we're with law enforcement, there's usually something a little bit more risky going on. But if we went out with EMS to do follow-up, it's another way to offer that service. And it's potentially less impactful for the individual that you're coming to if they've had an unhappy experience with law enforcement. And I think we're shifting that energy as well. So we're hearing more and more from community members that what used to be a more fearful relationship with law enforcement is now becoming viewed as one of a helping resource.
We need to wrap this up soon, but any further thoughts, Councilor Pease?
Just one question. Is there any way that we could have a person on standby?
Standby is okay. The problem is if we are going to a high-risk situation, being with law enforcement when we go in, they clear the way for safety before we go in, and then they tell us when we can go forward with them. So it's always at their request that we go in.
The only reason I ask that question is an officer is on a scene right now where they have that person there, and they have another call.
Mm-hmm.
Who fills that spot? You know?
What kind of call are you referring to? Like an overdose situation?
Yeah.
Well, so hopefully everybody knows that we also, as the police, carry Narcan with us on a regular basis.
Yes,
We administer Narcan several times a week, as does the Lewiston Fire Department. So between us, the fire department, United Ambulance, Auburn Rescue, if they should be coming to our community, they all have Narcan on them, as well as it's legal to possess, and like we're talking about with the boxes here, many people in the community have it on them themselves. So many times we get there and they inform us, okay, that person's already received 1 dose of Narcan.
Yeah, I was just curious. I wanted to follow up on it.
Just, the Auburn program they're trying to set up would be split 20 out.
Stephanie has a question. No, Stephanie had a question. Could you?
No, I was just going to say really quick, and it's kind of a follow-up to the the Narcan discussion, but when you talked about, this is just a seed I want to plant, but when you talk about, there being changes with the challenges rather with the MMA regarding installation of naloxone box, I have to just tell you that doesn't make any sense at all. I mean, in the name of humanity, it just doesn't even register for me. So somehow we've got to get in front of that group and but that's just a seed I'd like to plant.
It's certainly,
believe-
I'm sorry, it's certainly something that we can discuss further with him.
Thank you.
Thank you very much, both of you. Yeah, I think this program is extremely beneficial, and thank you both for your efforts.
Thank you for hearing us.
We're heading into executive session, and we'll be back for the council meeting. Good evening. If you can please join me join me in standing for the Pledge of Allegiance, that would be great. Madam Clerk, please do us the honor.
I pledge allegiance
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
So as mayor, I get to serve on the library board. And so this week, I got a new card. I encourage all residents to go and get their Lewiston Library card. It's a gem in the city, and we are lucky to have it. Madam Clerk, we are ready to begin.
Sure. All roll call votes for this meeting will begin with the counselor of Ward 3. And the next item will be acceptance of the minutes of the January 18th, 2022 City Council meeting.
Do I have a motion? Councilor Pease, followed by Councilor Clement.
And if there's no discussion, I'll be happy to call the roll.
Please call the roll.
Counselor from Ward 3?
Yes.
Ward 4?
Yes.
Ward 5?
Yes.
Ward 6?
Yes.
Ward 7? Yes. Ward 1?
Yes.
Ward 2?
Yes.
Motion passed by a vote of 7-0.
It is now time for public comment. Any member of the public may make comments regarding issues pertaining to Lewiston City Government. This period is reserved for non-agenda items. Public comment is also allowed during individual agenda items. Public comment is limited to 3 minutes per person. Please state your name for the record and if you are a Lewiston resident. Because this is the business meeting of the City Council, all questions should be directed to the mayor, who will ask staff to follow up for a future time. It is illegal for City Council to allow comments related to personal matters. All personal complaints should be made directly to the administration office. Public comment? The consent agenda?
We don't have any items on the consent agenda this evening for tonight's agenda.
Item number 1.
Item number 1, public hearing and final passage regarding an amendment to the Cable Television Ordinance to eliminate the Cable Television Advisory Board. Requested action that the proposed amendments to the City Code of Ordinances, Chapter 24, Cable Television, Sections 24-20, Cable Television Advisory Board, receive final passage by a roll call vote.
Councilor Pease?
Second.
Councilor Clement? Discussion?
Move for passage.
Please call the vote.
And if you could go to the public, Mr. Mayor, thank you.
Public comment? Back to the council? Madam Clerk?
Sure. Counselor from Ward 3?
Yes.
Ward 4?
Yes.
Ward 5?
Yes.
Ward 6?
Yes.
Ward 7?
Yes.
Ward 1?
Yes.
Ward 2?
Yes.
Motion passed by a vote of 7-0.
Item number 2.
Item number 2, public hearing and final passage to amend the zoning and land use code and map by eliminating the office service districts and to rezone the affected parcels into low-density residential, highway business, industrial, or rural agricultural districts as recommended by the staff and the planning board. Requested action to approve final passage to eliminate the office service zoning district and to rezone the affected parcels into low-density residential, highway business, or industrial, rural agricultural districts as depicted in the attached maps 4, 5, and 6 and ordinance amendment.
Councilor McCarthy, Councilor Harriman. Discussion.
Public hearing.
Public, discussion from public? Anything from the public? There we go. Back to the council. Councilor Clement.
Thank you, Mr. Mayor. This is in my ward. I've gone over this before and will vote in favor of it. I think it makes absolute sense. Thank you.
Further discussion? Madam Clerk, please call the vote.
Counselor from Ward 3?
Yes.
Ward 4?
Yes.
Ward 5?
Yes.
Ward 6?
Yes.
Ward 7?
Yes.
Ward 1?
Yes.
Ward 2?
Yes.
Motion passed by a vote of 7-0.
Item number 3.
Item number 3, public hearing and first passage regarding an amendment to the Code of Ordinances, Chapter 22, Article 15, pertaining to the licensing of marijuana businesses. Requested action, that the proposed amendments to the City Code of Ordinances, Chapter 22, Article 15, Adult Use and Medical Marijuana, receive first passage by a roll call vote, and that the public hearing on said ordinance be continued to the next regularly scheduled City Council meeting.
Motion? Councilor LaChapelle.
Second.
Councilor Clement. Open for discussion? And I noticed that we have Director Hediger here for questions, if necessary. Councilor Harriman.
Yeah, I just wanted to ask Director Hediger, so I appreciate the maps that you provided. And I think we might have gone over it at the last hearing, but is there currently a buffer for businesses that sell alcohol? If this, a buffer from schools and parks and daycares?
No.
And how about for residential properties in residential zones?
For businesses that sell alcohol?
Right.
No.
And how about for businesses that sell tobacco?
No.
No, okay.
And just to be clear, the item agenda you have in front of you now does not have those buffer requirements in it. Those will be in the next agenda item. So if there's more questions, I can refer to that map and try to help out.
Director Hediger, would it be possible for you to walk the council through your map?
Sure. So again, with respect to agenda item 3, what's largely happening here is we are removing performance standards, the buffers that were just referred to, and moving those into the zoning and land use code. Those are found in agenda item number 4. Also in agenda item number 3, we're adding language in there that makes it clear that there's an appeals process now if someone wants to challenge either the issuance or denial of a license. We're adding in there a sunset. We talked about that during the workshop, that if a permit isn't issued within 180 days, it'll be deemed denied. And we're updating the definitions to be consistent with state law. That's the majority of the changes with respect to item number 3.
Councilor Peace.
Just one question on that. I agree on the 180 days. That's not an issue. And they can ask for an extension for another 60. Is there a time frame that they have to ask that request prior to the end of the 180 days? Or can they wait till 179 and then ask for it?
They can ask on 179. I might even give it to them on 180. But yes, there's no 181. They're not going to get an extension at that point.
Right, thank you.
Councilor Harriman.
Just one more question about the, I think I also mentioned it the last time, about the prohibition on odors. On odors from marijuana stores and facilities. Do you know how about that came up as a complete ban on any odor?
When this was initially drafted back in 2019, that was a concern. If we get a complaint about marijuana businesses, it's odor. That's really, and it's not even really about businesses. I think I mentioned usually it's somebody doing an illegal grow in their residential property. Marijuana is inherently odorous. Most communities look to have an ordinance where they try to control that to the greatest extent possible. So we kind of took our lead from what a lot of other communities have done. Again, that was language that we adopted in 2019. We're carrying it over here. And we're making it clear to keep it both in the licensing section and the zoning and land use section. So kind of belt and suspenders as far as making sure these business owners address odor with their establishments. It's usually only an issue if it is an issue with grows, retail. I'm not sure that we've ever received a complaint from a retail establishment.
Okay, thank you.
Councilor Peace.
Only one more question on that is how is this going to affect agenda item number 5? You know?
We can talk about that with item number 5. With respect to item number 5, Actually, what you do in number 3 is not going to affect number 5. What you're going to do in number 4 may impact number 5.
Okay, thank you. Thank you.
Public comment?
Is that it?
I'm sorry?
Yeah, come on up. Yeah, absolutely.
Please state your name and your address, please.
Yep, Pierre Renault, 313 Ferry Road in Lewiston. I was just questioning, is that printout that you have available to the public, draft, that he's referring to, the 5 agendas?
Yes.
Is there a copy?
Not here, you could go online and get that.
Oh, okay, it is online? Okay.
Hello, Mayor and City Council members. Thank you for your time. My name's Alex McMahon. I live at 46 Lisbon Street. I own and operate 2 marijuana retail stores here in Lewiston, as well as 1 marijuana manufacturing facility here in Lewiston, as well as I do have a pending license for another manufacturing facility here in Lewiston. I mainly want to thank all of you for your time and effort into working on this. I know it's, it seems like a lot of marijuana talk kind of always, but it is a new emerging industry. I want to thank the Department of City Planning. I think they've done a really good job in crafting and in changing these ordinances. I simply want to point out 2 things that I think might have been overlooked, real minor things that I think should be addressed before the final version goes into effect. So on page 3 of Article 15, the definition for marijuana manufacturing facility right now references that a marijuana manufacturing facility may manufacture, label, and package adult use marijuana and adult use marijuana products and sell adult use marijuana and adult use marijuana products. I think the terms adult use should be stricken just so that it is all inclusive of medical and adult use. And again, I don't think that was intentional. I think that it's just a slight fix that needs to happen. Over on page 11 also, section 22-430, number 1, there shall be no cultivation or storage of marijuana products, or related supplies outside of a structure. I definitely have no problem with the storage or cultivation of marijuana or marijuana products outside, but the related products, I believe, is just a little too vague. And actually, I think the intent of the Department of City Planning was to strike that. As you can see, if you reference page 1 of Appendix A, so page 1, section 21.2 of Appendix A, you'll see the same language. However, related supplies has been stricken. And so I think it just needs to be carried over into Article 15, that related supplies is stricken, just because, what is related supplies? Are we talking shovels and pots, or I think it's marijuana and marijuana products is, addresses all the public safety concerns that it needs to. That's all I have to say. Again, thank you all for your time and work on all of these marijuana issues. Thank you.
Further public comment?
I'd like to say
Can you please go to the podium and introduce yourself and state where you live?
Dr. Ras Masood, and I was in long-time practice.
Excuse me, do you mind going to the podium behind you?
Right over there.
Right there. Thank you.
Sorry. My practice included pain management.
Excuse me, can you please state your name and your address?
Ras Masood, and I live on 75 Montello Street.
Thank you.
Okay, as I was hearing about you talking about marijuana in our time, maybe a couple of years ago, there was no such thing. And there was extreme abuse of I would write pain medication, my Darvocet and Darvon, and I had very hard time dealing with that, and I had a very bad experience, a bad name for that, and some people accused me as being pill pushers, and some of them tried to blame me for their action when they landed up in emergency and they had to lavage it. So to cut a story short, It's something new because I've not been in practice for about 10 years. And I do not know when you introduced this marijuana distribution. But lately, I've become aware of it, that it is helping people to get out of addiction, which is good for the doctors because they were very blamed for any misused medication for which they were not responsible. But we got blamed for it, not under guidance of licensed people who distribute in their shop kind of things. That's it. If you accept my thank you for on the behalf of doctors who had a very hard time keeping their reputation. They were called pill pushers, and it was solely on the basis of the habit of the patients, and there was all sorts of stories from the patient side in order to get those pills. Thank you. Do you have any questions about it?
No questions. Thank you.
Okay, thank you.
Any other public comment for this agenda item?
My name is Dominic Jampala. I live at 8 Balsam Street here in Lewiston. One thing I would just like the City Council to consider is that with the use of adult use marijuana and people smoking it in public, it becomes a place where if this is prevalent downtown where you can't take your family. Unlike something, say, like alcohol, if someone's drinking alcohol, you may smell it, but it doesn't affect you physically. Whereas, for example, we were in Portland with my family out front of Gelato Fiasco, and people were lighting up all over the place, and I can't have my kids, breathing marijuana smoke to the point where it's affecting you. So please consider that, with the use of the location and the allowed use of smoking in public. Even if the ordinances say people aren't supposed to do it, it certainly happens. And I think that we need to consider that if we want Lewiston to be a family-friendly place, at least in the downtown area. Thank you.
Thank you. Further public comment on this agenda item? Back to the council for discussion. Councilor Clement.
Interesting point the gentleman just brought up. Drinking in public is against the law. There are ordinances and laws against that here in the city, and perhaps we ought to consider making smoking marijuana in public. We have several prohibitions against tobacco currently in certain areas, and maybe we ought to extend that to marijuana smoking as well.
Councilor LaChapelle?
Question for Director Hediger. The points the gentleman made in regards to the changes in this, what's your feeling, your take, what's staff's recommendation?
He's probably wondering why they're not in there because he brought them to my attention, and that was absolutely an oversight on my part. No concerns with that at all. I would suggest that the council, if they choose to move forward, include those amendments that he referenced.
Okay. Would you be so kind as to get the exact changes that he was suggesting?
Yeah, actually,
Did you write them?
I apologize. I have those. You don't.
You do have them? Okay.
Yeah, so I'm aware of them. You just don't have the right copy with those changes in there.
Okay, thank you.
Yeah.
Just for clarification, you're saying those changes were basically already approved?
Well, not approved,
Or
but
not,
when we've had
considered.
Exactly. We had
Okay.
a workshop. Alex was at that workshop. He brought that to our attention. We thought that was a reasonable change. You just don't have a version that includes those changes in there.
Thank you. Councilor Scott.
And that was what I wanted to ask as well. Thank you, Councilor LaChapelle. So that will be in our second reading? That language will be in there for our second reading?
Correct.
Okay,
Well-
thank you.
Oh, sorry.
Councilor LaChapelle?
My question now is, can we just amend our motion right now just to adopt it with those changes as the first reading? You can't do that?
Madam Clerk.
So I'm sorry, I didn't quite hear what the question was, but
There's-
my understanding is that there's just some minor word changes that didn't make it into the first packet. So what's before you right now is first passage, and we can incorporate those word changes into final passage. It sounds like they're going to be pretty minor from my understanding.
Okay, thank you.
Councilor Harriman.
So, yeah, I totally agree with those changes, and I just wanted to make clear that, so voting to approve this and move it forward to the second reading, we will incorporate those changes.
Right, because they're not going to be substantial changes, Counselor. They're really just deemed minor, sort of almost housekeeping, I think, changes, just to tighten it up because the council's already reviewed it and discussed it, it sounds like, yeah.
Thank you.
Further discussion from the council? Madam Clerk, please call the vote.
Counselor from Ward 3,
Yes.
Ward 4,
Yes.
Ward 5,
Yes.
Ward 6,
Yes.
Ward 7,
Yes.
Ward 1,
Yes.
Ward 2.
Yes.
Motion passed by a vote of 7-0.
Item number 4.
Item number 4, public hearing and first passage regarding an amendment to the zoning and land use code, Article 12, Section 21, pertaining to performance standards for marijuana businesses. Requested action that the proposed amendments to the zoning and land use code, Article 12, Section 21, pertaining to performance standards for marijuana businesses receive first passage by a roll call vote, and that the public hearing on said ordinance be continued to the next regularly scheduled city council meeting.
Move for first passage, Mr. Mayor.
Councilor Clement. Councilor McCarthy. Discussion from the council? Councilor Scott.
Yes, so Director Hediger, so my question to you would be, if this moves forward, how would this affect our next agenda item? I know that that was asked already, but I feel like particularly the 100-foot buffer in a neighborhood would affect that.
So I'm going to go up to the laptop and I'm going to show you. So this is actually in your packet, and this is directly related to the next item in your agenda because it is the property in question. So,
David, it's not up yet.
but just imagine you're seeing things right now, you know. The man behind the curtain's working his magic right now, I think.
We're checking on the man behind the curtain.
While he's doing that, let me,
It's the map we have here, correct?
exactly, you're going to be looking at this map here with all the circles on it. And let me grab something. Well, I'll try to answer Councilor Scott's question while you folks are looking at this map. So it should be the last page in your package. Okay. The current standards right now measure, if you recall, one of the changes that we want to make regardless of what we decide for buffers here is how the measurement is taken. You'll recall that the current ordinance talks about an ordinary course of travel from door to door. That's just problematic. It's problematic for staff, for the applicant, for the neighbors. Everyone's measuring where from, what is the main door? How are you measuring that? What's the ordinary course of travel? What we're looking to do is basically come up with a radius now from the property that needs to be protected. So whether it's a school, daycare, or a property in residential use. And that's the question at hand here that Councilor Scott's talking about, which also relates to the next item. So instead of measuring from the door of that residential use in a residential district, it would be measuring from the property line of that residential use to the business. So we know where a residential property is, we know where the line is, we can easily draw a buffer around that. we've given a couple options on that map there showing a 50-foot buffer and a 100-foot buffer. And then if any portion of that property or that business but those portions that fall within the buffer wouldn't be allowed to be a marijuana business. If you look at that, and it's, I don't know how confusing it is, and we tried to label it there, but you'll see a number of different circles around it where we've shown a 50-foot buffer from the property line and then a 100-foot buffer. And then the property in question, so the property in question in your next item is going to be this larger square here. The residentially zoned properties are over here. And this would be the closest residential property. So if we have a residential property like this, and then you have the buffers that extend out from that, versus you'll see like a little line coming from the front door and like wandering to another front door of the business. That's how we would measure it today. And when business operators can't meet that or they're close, they're like, oh, well, I'll put up a fence. I'll make the distance longer because now I'll force people to walk around it. Everybody agrees that's a silly way to try to meet the ordinance, the intent of the ordinance with separation. So the goal with, specifically with this section of the amendment, because there's a number of amendments you're considering, right? In this section, there's buffers from residential uses, buffers from other marijuana businesses, and buffers from residential uses. Specific to this residential, the question is, what is it the council wants to see for a buffer? Do they want to see 50 feet? Do they want to see 100 feet? Do they want to see no buffer at all? What I would recommend is that we come up with some type of buffer and not do what we're doing now, because what we're doing now just isn't in anybody's best interest. I would almost say we'd rather do nothing than continue measuring it the way we are.
Councillor Pease.
What determines what residential property you're going to use to determine that on that property?
The closest one.
Just the closest one?
Yeah.
Even though that there are other properties that abut the same property?
Correct. So, I mean, if we could, in this situation here, you're absolutely right. There are other residentially zoned properties along that northerly property line. But if we draw circles around them, they're only going to be that much further away from any portion of the building that's going to be impacted. So we want to make sure we pick the building, the residential property that's going to be closest to wherever the activity might occur.
Okay, thank you.
Yep.
Councillor McCarthy.
I'm looking at this, and it says it's already a conditional use. Why is it considered a conditional use?
I think you're referring to somewhat in part the next item.
Oh, okay.
I mean, I can go into that, but
Well, I can reserve my question.
Right, yeah.
Okay, thank you.
It is up on the screen now if folks need another explanation or more clarification.
Further discussion from the council? Councillor Harriman.
So I remember last time we talked about those narrow highway business districts along streets such as Sabbath Street, Lisbon Street. Was there a similar map that we got that has, and maybe I just missed it, that has the way a buffer would impact those districts?
Yeah, so late today, you folks got an email, and on front of your desks, on your table today, you have this, and I'll pull that up as well. So recognizing that this is kind of, there's a series of maps here, and I'll walk you through them. The first page of your map here is just showing you the zoning, and the dots represent various types of marijuana businesses. They could be retail, they could be grows, they could be manufacturing, and they're either active or pending licenses. So all those dots represent some type of marijuana business. And you get a sense too, as far as the narrowness of the zoning. And I thought that I had a tool on here, but I don't see it right now. It's not going to do what it wants. There we go. So, example, like this is Sabata Street running through the middle of the screen right now, and you can see how that's a narrow zoning district through there. And immediately behind it is a residential district. So where you see these dots down here, there may or may not be concerns about where a buffer is located because you have residential uses right behind you. The next page in your application or of maps, you got red and orange circles, I guess. This is buffers from childcare. So you may recall that we talked about being more onerous than the state. The state has setbacks from schools. They don't regulate setbacks from residential uses. They don't have residential setbacks from parks. They don't have setbacks from daycares. That was something that the previous council thought was important to include with schools. So again, your blue, green, red dots, those are marijuana businesses, and then you see these circles. And as the legend is, the orange color there is a 500-foot buffer. The red is 1,000. 1,000 is what we're recommending. That's what you have before you tonight. But you get a sense when you look at this as to what areas may get impacted then. For example, over here where the cursor is, that establishment would likely become non-conforming if you had a 1,000-foot buffer, which is fine. It's non-conforming as long as the business is there. It doesn't go out of business for more than 2 years. They're grandfathered. They're legally non-conforming. But you would not be able to put another business anywhere within that red radius if a 1,000-foot buffer was adopted. You go to page 3. Page 3, that is parks and open spaces that the city regulates. So again, just to put it in perspective, I guess the light blue would be 500, and the purplish color, I should have put easier colors for me to describe here, that would be 1,000 feet. So when you look at downtown, and I know that came up with some discussion, downtown, this is Kennedy Park where I have the cursor, Samard Payne Park, Hoffman Park, Gaslight Park, Knox Street, Parkett Park, and these dots represent businesses. And again, the dots of the businesses, obviously are a little, not to scale, but the point being is you want to reflect on these colors, right? So this is the light blue is a 500-foot buffer, the purplish color is a 1,000-foot buffer. So if we have 1,000-foot buffers, which again is being tied into the school setback that we'll discuss here, you're going to eliminate most, if not all, of downtown for marijuana businesses. All these blue, yellow, blue, red, green dots, they'll become non-conforming. They'll become grandfathered establishments. Page 4 is schools. Same idea. Blue is 500 feet, and yellow is 1,000. And 1,000 is what the council was suggesting we go with at the last meeting. So Franklin Pasture, Martell, while it's still considered a school property at this point, you can see big, huge areas being taken out of consideration for marijuana businesses. Not as many non-conforming, right? I mean, like downtown doesn't become non-conforming if you're just regulating schools. And we'd have to get it, this map is, again, the scale is a little off on this, but like where the cursor is, for example, here, this is what was Elizabeth Ann's, and there's a marijuana store there in the corner. Might that be within 1,000 feet of Farwell? This map suggests it is, but if we looked at that a little more closely, with a green dot not being as huge as it is, it may or may not be a conforming use at that point. So the last page gets really messy. Last page is every buffer we got. And it's just to give you folks an idea for purposes of discussion, like, okay, where are we going to all of a sudden be eliminating uses from going in further? Let me zoom in one more time. Sabata Street, this is outer Sabata Street coming into town. There's probably still opportunities there. Again, it's going to depend on the other buffer discussion we're having about 100-foot buffers from residential uses. I didn't put that on here because that's going to depend, as to where our business is going to locate. But you can imagine if we include all the other buffers from daycares, daycares, schools, playgrounds, and parks and open space, this is the map that we would kind of be looking at here. and you can start seeing where spots may or may not be available. Lisbon Street is pretty good. You get some nonconformance maybe down here, probably due to the Acadia School down there, down by the Lewiston Industrial Park. Downtown, though, you can see downtown is pretty much off limits, right? Anywhere from East Avenue over to Sabata Street, down to the river, it's gonna be hard for anyone to establish something down there. Going up Main Street is hit or miss. And again, you gotta keep in mind, not all these zoning districts allow marijuana businesses, right? It's, you have a gap here where the cursor is. Well, there's a gap there now anyway, because those are residential zoning. You don't allow, commercial activity, let alone a marijuana business there. Outer Main Street looks like would probably be pretty good out there.
Some of the locations you're describing, would it be safe to assume that they might be also impacted by the residential setback? Or
absolutely. Without knowing specifically, but let's pick on that red dot there. If we come up with a setback that's 100 feet from a residential zone, that's a narrow zoning district there, right? So on either side of this gray line, this area is residential, this area is commercial, this area is residential. We put a 100-foot buffer around a residential property. Might that property become non-conforming? Might that marijuana business? It very well may. We'd have to map each one of those to see how they would be impacted. And that goes back to the two other examples that you had in your packets. What's on the screen now and the one I showed from last week, where you have zoning boundaries and a potential marijuana business, and how would those setbacks impact it? If the council decides to go with a 100-foot buffer, absolutely, there will be fewer opportunities. How many fewer, I'm not certain. I mean, literally, we'd have to do 100-foot buffers all along that to figure out which properties are no longer going to be available for marijuana businesses.
Thank you. Councilor Harriman.
Yeah, I guess that's the information that I was hoping to get, and I realize it's probably a ton of work to map that out, but I kind of wanted to see this final page plus, including all of the proposed changes here. So this page plus the residential setbacks,
Yep.
just to see how much that would limit things.
I mean, sorry.
No. Because if we're talking, so where that dot is, what street is that on?
This is Lisbon Street.
Sorry, no, the one that you had before.
Oh, yeah, that was Sabata Street.
That's Sabata, okay,
Yep.
yeah, I'm just making sure. So Sabata, so chances are, there could be very few places on Sabata Street which would allow marijuana businesses going forward, depending on the residential setback. Is that correct?
That's correct.
It's a very narrow district.
It's absolutely. I mean, this doesn't have the property lines on it, but you can get a sense by looking at the buildings on here, right, that the zoning is really one lot deep.
Right.
In a lot of cases, the lots are, 100 feet deep? Maybe they're 200 feet. I can tell you, now that I've zoomed in, I know where we're talking about. This is the corner of Sabatis, Old Green Road, Randall Road. There's a store there on the corner. It immediately butts a residential district. They would not be allowed to go there. In that entire block, if where the cursor is right now, I know for a fact that block is 200 feet deep. So you put a 100-foot buffer off the back of these properties here in the residential zone, the whole front block there will no longer be available for marijuana businesses.
To Councilor Harriman's point, chances are large swaths of Sabata Street would be ineligible.
Certainly many more spots, yeah. I mean, how many, I'm not certain, but yeah, there's going to be a lot of areas that would be prohibited from marijuana businesses.
Thank you. Councilor Clement.
For Mr. Hediger, the red dots you show on the maps here variously, are these businesses that are within the grandfathering state right now that they could reopen?
Yes.
Okay.
Yes.
So they wouldn't, there would not be anyone on here now that is not eligible?
That's correct.
Okay.
Correct.
Very good, thank you.
I mean, that's been an interesting conversation. I mentioned, without I mean, there almost isn't a day I don't have a discussion about marijuana. And it's, with these pending changes, people are asking that, you know, how are these changes going to impact me? How can I get in there? If it becomes as strict as maybe what's being proposed here, how's that going to impact me? When do I get my license in? Those types of concerns. Everything you have before you tonight, though, they're fine. They're either in the process or they already have a license.
Thank you.
Councillor Jelinas.
Thank you. Director Hediger, when we came together for a workshop, one of the things, the numbers before us, when I look at the protected use categories and the setback from protected use, the footage there, and I'd asked you when the numbers were smaller, so I'm going to ask you again, are those numbers, especially as it pertains to schools, childcare facilities, parks, that kind of thing, is that more or less protected than the state at this point?
The minimum requirement of the state is 1,000 for schools. They'll allow municipalities to go as little as 500 feet.
Right.
We're currently 750, but we measure it that funky way again, right? The ordinary course of travel. So our goal is to try to measure it the same way the state does, and then it's really up to the municipality as to whether or not that's going to be anything from 500 to 1,000.
So with these numbers before us, what I hear you saying is that we are at the minimum of what the state requires.
With respect to the school, no. 1,000 feet is what the state would. That's their requirement unless the municipality adopts otherwise.
Okay.
But again, it only applies to schools. They don't regulate childcare. They don't do the playgrounds or recreational facilities, anything like that.
Thank you.
Councillor Harriman.
And then does the state have any, I see the final item there, the setbacks between marijuana stores. Does the state have any say, any rules about that?
Not that I'm aware of.
That's local, okay. Thanks.
I should note, while you're looking at that, there is a typo on this table here with respect to the very last box where we're talking about pre-existing dwellings in residential zoning district, and then it says 100 feet. And what the buffer is, the buffer from the property line of the main entrance of the dwelling, that's an oversight. It's the buffer from the property line of the dwelling of any portion of the marijuana business. We're getting away from the main entrance. That was language that was carried over from last time.
Public comment. Please state your name and address, please.
Yeah, Pierre Reno, 313 Ferry Road. I'd just like to say that before you consider all these changes, whether it's a cap or buffers or all that, you got to understand that you're picking winners and losers. You already limited everybody to commercial property to have a business. You don't limit any other business, type of business. You know, it's always about how much money you can get out of the cannabis industry. And I just think that, you know, I look around at town and I see Emerald River going up, and it's 50 feet from a house. And that were they scrutinized just as much as everybody else? And same with like the Weed Mart. He moved into Stevens' old store, and his house is like 50 feet from him. You know, so I'm just wondering, you know, why is it all of a sudden coming up now when you're talking about caps and buffers when everything seems to be had worked pretty good already? You know, you've limited us already. So just consider that, you know, when you go to vote.
Mr. Mayor.
Any other public comment? Back to the council for further discussion. Councillor Clement.
To the gentleman's comment, I believe that the reason that we're looking at this now is because there is not regulation, and these things have been allowed to develop just willy-nilly. And that's why we've heard from people in the city that they want to see some regulation, they want to see some conformity. And that's the reason why we're bringing these things up. And we are taking care of some wrinkles that were in the original ordinance that were passed. We had a situation develop last term between a potential business and a daycare facility, and that was the measuring from door to door, around the flagpole, up the tree and around, and it was impossible to determine what the setback should be. So that's the reason this has all come about, is because people are looking for some type of regulation. Thank you.
Councillor Harriman.
I want to apologize for kind of jumping the gun with on the previous item there, about the buffers. I just feel like our rules should have some kind of logic to them, and if I can open a store next to a daycare or a school and sell beer and cigarettes, I'm not sure why I can't open a store and sell marijuana there. It just doesn't seem very, very business friendly to put all these restrictions that are going to basically amount to a ban in large parts of the city. We talk about economic development a lot, and it seems like this is just the wrong direction to go as far as that.
Councilor LaChapelle?
Thank you, Mr. Mayor. Spent some time talking to some of my constituents in our area. I'm not in the downtown. One of the concerns is letting the free market prevail. Sooner or later, there's going to be too many stores. It's like the Dunkin' Donuts. There's only so many Dunkin' Donuts you can have in every corner, and some of them will close down. A lot of these facilities are going into some buildings that are in rough shape, and they've done a good job cleaning them up. I was one of them that pushed for the 1,000 feet away from the schools. I might be inclined to stay at the 1,000 feet from the schools, but start eliminating the whole playgrounds and this and that, and it just start bringing it back a little bit and just maintaining the schools, and then going to the 50 feet setback on the, not the 100-foot buffer, the 50-foot buffer. But it has to be into a zone, it has to be in the zone that's permitted, correct?
Correct.
Excuse me, when you said buffer, you were talking about residential?
Correct.
Okay.
The residential buffer.
Right, 50.
Please continue.
Yeah, sorry, 50 versus 100, but it has to be the buffer would be from a residential use in a residential district. So many of our commercial districts have residential uses in them, right? You drive down Sabata Street, Main Street, you see residential uses, but they're in a commercial zoning district. Staff's intent was never to have a buffer from a residential use in a non-residential district. So it would only be from a residential use in a residential district. It's up to the council what that number should be, 50 feet, 100 feet, no buffer. And we could do no buffer, but I would absolutely prefer or recommend to get away from how we're doing it now with the measurement of door to door. That's problematic.
Might I continue?
Please continue.
Have we had any complaints for our existing stores that are out there right now? Any? Smell, too many people, rowdiness, any complaint at all?
We've received a handful of complaints about odor, but they were from grows, they weren't from stores.
I'm sorry, they were from what?
Grow operations, not
okay.
stores.
Right.
Stores, I don't believe our department has received any complaints. I know I talked to the police chief prior to the workshop as well, just to get a sense from him, are these uses a problem for his department as well? And he indicated that they weren't. So no, I guess not, to answer your question from a store perspective. A number of these projects go through development review, either through the staff review committee or the planning board. We've had a handful of neighbors show up at them. The one that we've had the most neighbors at is your next agenda item. But other ones, the one on your screen actually, that went through the staff review committee. I think we had one, maybe two neighbors there. And he actually, he brought up the point, how many marijuana stores do we need in the neighborhood? But that was it. It was just more there to learn about the project and what was going on.
In your memo to the council, I noticed you mentioned that the planning board was in favor of some kind of limit. Can you please clarify that or expound upon that?
Yeah, I think they've expressed concerns, and Councilor Scott could probably weigh into this too, because some of these conversations came up when she was on the board. Again, I think there's this perception, maybe that some counselors share as well, as, are there too many marijuana businesses in the community? And when we brought this forward to the planning board, the initial amendments that you folks had a recommendation from, they were in favor of the changes, but they recognized that because it's tied to licensing, is there something that the council should be considering with respect to these setbacks? Do we have too many of them? Are there not enough? The planning board did hear at the last meeting from neighbors that, why is this going in my backyard? We have enough businesses, other places in the community that we could locate these. Why pick this location? So that's kind of the sense of where the board was going with that, as far as, is this a problem? Should it be a problem that needs to be addressed? I think it's really a matter of opinion out there. This is still a new use. Some of the comments that Councilor Harriman made, even from the state's perspective, they're constantly changing the rules. This is a new item, a new topic that's being regulated, and how do we go about that? And I'm sure I'm going to be back before you guys here in a couple of years with other changes and updates as everyone learns about whether or not there are impacts to these establishments on abutting abutting properties.
If I'm to understand you correctly, it was, I guess at planning board level, it was simply a discussion about whether there are too many and should there be limits, and it wasn't like, a numbered list.
No, it wasn't a numbered list. It was more just, is this a problem? We should have a discussion about this. We encourage the council to look into this.
Gotcha. Councilor McCarthy.
Alcohol was brought up. Now, hard liquor is regulated by the state, correct? And only certain stores can have it? So you can't just say, okay, I'm going to open up a liquor store here and just open it up. It needs to go through the state, and there's state regulations and to limit the number of alcohol stores, correct?
Correct.
So this is really no different, just on a city level, dealing with marijuana than hard liquor is by the state.
Yeah, to be clear or build upon that, in this case, we have a specific use category for marijuana businesses. We don't have a use category for retail establishments that sell alcohol. We do for drinking establishments like bars, but if we're talking just your typical beer, wine, liquor store, that's a retail use from a zoning perspective. The state then goes above and beyond that and says, hey, only so many licenses are being issued in the community for certain establishments to sell beer, wine, and liquor.
Councilor Clement?
Mayor, just to Councilor McCarthy's point and several points that have been raised, alcohol is regulated to a certain degree. Marijuana is still an illegal drug federally. Okay, federal law prohibits marijuana. The state of Maine has accepted it for recreational and medicinal use. It is still illegal federally. Now, do I think that the feds are going to come in here and start? No, probably not. But it is illegal, therefore it makes sense that that we look at it in that regard, that we have some control over it. Thank you.
Councilor Scott.
Thank you. So just to try to wrap this all up here. So we're looking at, you've got 4 specific things here, and in my opinion, any one of these things are actually going to help with the cap, because this is going to change some of the way we're doing. So I think it's already going to sort of push towards not having as many as we currently have now. The 1,000-foot setback for schools, that the only language in the state is for schools, just to reiterate that. There's no language in the state around childcare facilities, parks, playgrounds, recreational facilities. We put that in ourselves.
Correct.
Okay. And property line on residential uses, does the state have any specific language on that?
They don't.
They do not. And increase between marijuana stores, specific on that?
Nothing.
Okay, so this
Not
is...
that I'm aware of. I can check for you, but that's my understanding, is there's no setbacks at the state level for marijuana businesses or stores.
So I would concur with my fellow councilor, LaChapelle, that I'm really good with the 1,000-foot setback around our schools. I think that that's important. But when I look at this map particular and I see the parks, right, that pretty much eliminates that eliminates quite a bit. And I understand that they'd be non-conforming, but they wouldn't be able to have, like we'll say the ones on Lisbon Street, didn't fill their licenses, or we have, right, and we have a couple of years. That means that if we put this in place, no more stores could open on Lisbon Street again, pretty much with this.
That's correct. So if it was a 1,000-foot buffer there, you're right. You're looking at all the purple area in the downtown there. So whoever's down there is down there.
Okay. I am a little concerned about that, because I think that, you know, I mean, I don't want to fill Lisbon Street with marijuana stores, and I think that we're limiting, but I also think that it is a good thriving business that we have down there, and it has been a thriving business, the couple that we have down there that have brought in money to our downtown, people to our downtown, and has contributed to our downtown. So I'm a little bit concerned with that particular piece, but I am in favor of the other pieces.
Councillor LaChapelle.
Don't know how to go about this, but I would propose just the changing the wording on that second line, increase setbacks to 1,000 feet from K through 12 schools, and eliminate everything else: childcare facilities, parks, playgrounds, and recreational facilities. The third, establish a 50-foot buffer from the property line of a residential district, and eliminating increasing the setbacks between marijuana stores to 500 feet altogether. I'm just throwing that up to see, just get discussion from the council on their thoughts.
Councillor McCarthy.
I'm having a hard time differentiating between kids that go to childcare and kids that go to play in parks not being exposed to the marijuana, but yet you're going to do that for schools. What's the difference? If a kid's going to school or the kid's going to the park, if he's seen a marijuana store or he sees people coming in and out or whatever, they're still being exposed to it. So if you're going to me, if you're going to eliminate, if you're going to do the setback from schools, it has to be every place where the kids are going to be, not just public schools.
Councillor Harriman.
I guess to that point, I would say that kids have to go to school. They don't have to go to a particular park or playground or such thing. But moving on from that, it's kind of like a administrative question. Where this is first passage, if we agree with some of these items but not all of them, what is the procedure? If we vote yes, do we just move it forward to next time, or what is the procedure for, as Councillor LaChapelle proposed, making amendments to this language?
Before I ask the Madam Clerk that question, any other, Councillor Clement?
Yeah, the reason we're here tonight, as I recall, is because of a situation on Lisbon Road where a business proposed to go in next to a daycare facility. We had a discussion about that, and we asked Mr. Hediger and his crew to look at the various ordinances we have and an eye towards the update. That's the reason we're here. Okay, that's the reason we have these things in front of us. And I consider daycare and schools, nursery schools, whatever you want to call them, when you've got young children in a learning environment or a daycare environment, no different than a school, and I will not vote to eliminate a buffer zone from them. Thank you.
Madam Clerk.
So, Mr. Mayor, one of the
Administrator Hunter.
It's okay. One of the things that we were discussing is it may be prudent hearing feedback and hearing feedback from the public is potentially tabling this to the next meeting and then splitting the vote apart. So we are taking each buffer or each distance, instead of trying to adjust all four of them in one vote, is pull them apart. Now that you've had at least 2 informational settings with the questions, then we can look at splitting that vote apart and do residential buffer, and then do the daycare buffer, and then do the adjustments for how to measure that distance.
Director Hediger, When you have other businesses besides marijuana businesses inquire in town, is there any feedback about the current level of marijuana? You know, for instance, a restaurant wants to come to town. Is there any discussion or any feedback about the level of marijuana businesses currently in town?
Not necessarily, no. I mean, that's not the topic of discussion when they come in. I mean, they're asking, how do we get through the review process? What's involved for building permits? They don't necessarily ask, is there a marijuana business next door? Or, boy, there's too many in the community. I mean, that comes up in passing, just like you folks have probably heard from your constituents. Is there too many? Is there not? I don't know that that's a factor necessarily. Hasn't necessarily come up to me that way anyway.
Thank you. Councillor Clement.
Mr. Mayor, I would propose we move first passage, and then at our next meeting, when we have a public hearing, we can divide the question and take each individually. That, to me, makes sense.
Councillor LaChapelle.
To respond to the councilor's concerns about children, I think we're all protective of our children. There's no question about it. So wherever they go, they can go to the movie theaters, they can go to the bounce park, the old Zares, they could go any place. So that broad statement is extremely difficult. We would just eliminate it altogether. I think we're villainizing a large part of our society, portraying them as very bad people that smoke marijuana, and that's not always the case. How many of us have had a beer or a glass of wine and we're not alcoholics and are not going out and running people over? So there are bad people every place, and there are people that are going to break the law. Our state has voted for it heavily and supported it. I agree on protecting some of the people, not protecting everybody, not some of the people, protecting everybody, but I also believe in the free market. And the free market will decide if there are too many marijuana places in town. I look at the existing facilities, and I haven't seen one that looks like a dive. They've done a fine job on their facilities, and they look professional, and they're maintained. So kudos to the people that are maintaining it. I've seen other businesses in our community that look far worse than that. I encourage continued discussion. I encourage the reason why I said K through 12 was more for the Bates College area. Is that considered the school, college? Does that totally take out Bates College?
Director Hediger, was Bates College on the map?
No, and what I was looking for is we actually refer to, in the previous amendment that you folks had, there's definitions in there. And in there, I believe, we included definitions for private school, referencing state statute, public preschool, referencing state statute, public school, referencing state statute. So we're taking the state's definitions here as to what a school is. That does not include a Bates College.
At this point, I would recommend to the council that we potentially, take Administrator Hunter's advice and table this issue. Councillor Scott.
Thank you. Just so that I can ask a technical question, if we were to do as suggested by Councillor Clement and pass it through the first reading and then individually take each one at the next one, would that eliminate us having the ability to change some language because we've already passed it on the first reading?
That, it depends on how drastically you'd make a change to it.
Okay.
Councillor LaChapelle.
I think we're going to be looking at some larger changes, so at this point, I make the motion that we table this to our next scheduled meeting for the first reading, so we can break things up.
I'd second that.
Seconded by Councillor Harriman. Discussion on that particular motion?
Motion is not up for discussion. It's a motion to table, Mr. Mayor.
Good point.
Madam Clerk?
Sure, and just for clarification, if Councilor LaChapelle doesn't mind, typically in the past, what we would do for the motion wording is to actually continue the public hearing to the next city council meeting. So you're not doing first passage tonight, we're just continuing public hearing, which will then move first passage to the next meeting, which I believe is basically your intent, is that correct?
That's what I said, yes, thank you very much.
Thank you, Thank you, Counselor. Okay, so if you're all set for the vote, Mr. Mayor?
Can
Sure, so-
can you please restate the motion?
Sure, so the motion is to continue the public hearing to the next city council meeting, which for your knowledge would be February 15th.
Is that what you seconded, Councilor Harriman?
Yes, it is. Thank you.
Thank
Just
you.
for clarification.
Thank you. All set for a vote? Okay, great.
Please call the vote.
Counselor from Ward 3?
Yes.
Ward 4?
Yes.
Ward 5?
Yes.
Ward 6?
No.
Ward 7?
No.
Ward 1?
Yes.
Ward 2?
Yes.
Motion passed by vote of 5 to 2.
Thank you, folks.
Thank you, Director Hediger. Agenda item number 5.
Item number 5, public hearing and first passage to amend the conditional zoning agreement for the property at 1046 Main Street in the Highway Business District to allow as permitted uses marijuana stores, marijuana cultivation, manufacturing, testing, nurseries, and registered dispensaries. I will note there are 2 items for requested action. The first item is to approve first passage to amend the existing highway business conditional zoning at the property located at 1046 Main Street to allow as a permitted use marijuana stores, marijuana cultivation, manufacturing, testing, nurseries, and registered dispensaries, and to continue the public hearing for final passage to the next regularly scheduled city council meeting.
May I have a motion?
Move to table to a time specific.
Second.
We have a motion on the floor and seconded by Councilor Scott. At this point, Madam Clerk, do we need to call the vote?
Yes, you would, because it is a motion to move this item forward, and Councilor Clement, to table this action or to postpone this action to a future meeting. Is that essentially?
This would be until such time as we clarify and pass or do not pass the previous questions regarding marijuana businesses.
Thank you. Thank you.
Can there be any discussion here per Robert's rules or no?
Sure, so this is not actually tabling per se, it's actually postponing the matter, which does allow a discussion, but again, the discussion is only to the merits of the pending motion, which is the postponement to a future date. It is not about the context of the ordinance language itself.
Would a question about how does this affect their business plans be appropriate now?
No.
Doesn't appear to be so, no.
Thank you. Councilor Herman?
Just to be clear, so this vote would be voting to postpone this item until after we have finalized the previous item?
Well, I'm not sure that it would be finalized. Go ahead.
It would be until after the council feels comfortable based upon the first 2 items that were, or the last item that was tabled.
Okay.
So once that is agreed upon, I think the intent of the counselor is to have that wait until those elements are decided before the council votes on this. Is that the intent?
Yes, ma'am.
That's what I thought.
And that would encompass both items 1 and 2 at the bottom of this?
I would assume that as well.
Thank you.
Well, actually, I think we're just voting on item 1. There's a 2-part question here, but if we could enjoin the 2 matters, then I would amend my motion to enjoin the both of them.
Would you like to do that to include?
Why not? Thank you.
Okay, and just for clarification, Mr. Mayor, for the benefit of the public, the second aspect that Councilor Clement is incorporating in his motion is to request the city council address and provide guidance regarding the number and possible cap of marijuana businesses in Lewiston, along with consideration of buffers and setbacks of marijuana businesses from residential areas. And Counselor Scott, do you agree to work with that?
Yes.
Thank you.
Make point of clarification, Mr. Mayor, I think we just did that on the last item, but if it'll move things along, whatever will move things along is what I'm for.
Madam Clerk, do we need to go to public comment for this?
You do not. It's not a public hearing.
Okay. Madam Clerk, please call the vote.
Counselor from Ward 3,
Yes.
Ward 4,
Yes.
Ward 5,
Yes.
Ward 6,
Yes.
Ward 7,
Yes.
Ward 1,
Yes.
Ward 2.
Yes.
Motion passed by a vote of 7-0.
Item number 6.
Item number 6, public hearing on the city's fiscal year 2023 Lewiston Capital Improvement Program. Requested action to conduct a public hearing on the city's fiscal year 2023 Lewiston Capital Improvement Program and receive public comments.
Councilor Pease, followed by Councilor LaChapelle.
They don't need a motion.
Second, but the motion is not needed, Mr. Mayor. I think we can go to.
Is it-
Just for clarification, Mr. Mayor, you don't need a motion because it's just opening up a public hearing. There's
We're
no
heading straight to
council
public
action.
comment.
Just, actually, all
Perfect.
you're doing is just receiving public comment. You're not even taking a vote. This is just one of the steps in the LCIP, and it's to have public comment.
Thank you for the clarification.
Thank you.
Public comment, please, on this agenda item.
Do you want to do a presentation?
Administrator Hunter?
Mr. Mayor, while we're waiting and seeing if public comment, I would like to inform the public that the capital improvement plan is located at the city clerk's office. It's also located at the Lewiston Public Library and can be found on the city's website under the Finance Department Financial Reports under the Lewiston Capital Improvement Program. So people can view the plan at that point in time. We will, the council will vote to accept the plan on March 1st, so we will be taking public comments up to that point and continuing after that through the budget. Hopefully by that March 1st date, we will receive recommendations from both the planning board as well as the finance committee. And right now, the plan calls for an FY23 total amount of $32,828,595 for the next fiscal year. And the 5-year plan totals about $153,000,6, get my decimals here. And then the detailed project listings are located, and it may be easier to have the public either look at it in the budget memo or at the table that's provided in the document as well for what projects are under consideration.
Thank you, Administrator Hunter. Last call for public comment? Madam Clerk, next agenda item?
Great, thank you, Mr. Mayor. Item number 7, resolve, accepting the memorandum of understanding between the City of Lewiston and the Lewiston Farmers Market Association for the use of city-owned properties for the Lewiston Farmers Market during 2022 and 2023. Requested action to approve the resolve, accepting the memorandum of understanding between the City of Lewiston and the Lewiston Farmers Market Association for the use of city-owned properties for the Lewiston Farmers Market during 2022 and 2023.
Second.
Councilor Clement, followed by Councilor Jelinas. Discussion from the council? Councilor Pease.
Just curious, are they going to put up?
Councilor Pease, can you please move your microphone? Thank you.
Gotta get used to that. Yeah, are they going to put up signs where they used to be directing people down Lincoln?
I think they have intentions of doing that at directional signs, I'm sure, and I believe representatives from the farmers market, if they want to come up and speak at the podium, they're better able to address those questions, but they are looking at proper signage to draw customers into this new location.
Yeah, because that was a highlighted area, a lot
Right.
of traffic. Where they're going, although it's still going to be a good location for them, it's limited on visual.
Right.
Thank you.
Please
Hello,
state your
Council.
name.
Yep. My name is Sherry Blumenthal, and I'm a resident at Two Swale Lane in Lewiston, and I'm on the board of directors for the Lewiston Farmers Market Association. And so, yes, signage is a big part, wayfinding signage. And we even think in the beginning that we would have some physical presence at our previous locations to direct people, and probably we do a lot of incentives and community programs to make sure people know where they're going and to support them in getting there.
Thank you. Further, Councillor Scott.
Thank you. I just want to state that I'm really happy that this agreement came forward and that you were able to find a way to continue the farmers market. It is a reality that the farmers market is a great thing for any community to have. This is a thriving public farmers market that we have. I visit it every week, and I'm just happy to see that we came to a good agreement and a good, nice space for it to be, and in a visible space where we can get access to it, and that's extremely important to me, so thank you.
Councillor LaChapelle.
I just want to say to the board, congratulations. You've done a wonderful job. It's a pleasure to go down there and shop. I've also participated. It's just well-run, and I think it's a great job. Continue the good work.
Thank you.
Many people go to the farmer's market to purchase vegetables. However, I've been to purchase macaroons. Councillor Clement.
Just briefly, Mr. Mayor, I believe that the farmer's market is a great thing. I just don't want people to lose sight of the fact of why we had to do this. It has to do with the remediation of Mill 5, which has been on the back burner for, I don't know, a couple centuries, I guess. So we had to do this. It wasn't a question of we wanted to put them out. It was something that had to be done so we could remediate the environmental hazards at Mill 5. Thank you.
Public discussion. Would you like to add anything else, Sherry?
Oh, no, just that we're very grateful for the opportunity to continue to work with the city and to be in the urban core. I've been part of supporting the farmers market for 15 years, and it's very precious to me, but so is the city, and I see it as an asset to the growth that's on the horizon and has been happening. So I think we can really see some exciting things happen even through this move. It's hard to move, but I think this is a good opportunity, and I think we're excited to build on it with everybody.
A quick question. So approximately how many vendors do you have, like, on average during the summer?
Between 20 and 25. And then we have rotating guest vendors that come in, and now we've voted to have part-time vendors because we know that our customers really enjoy variety. So we're trying to bring that more into the market.
What has been feedback from the vendors in their participation at the market?
We've got a vendor here. He's our chair. You want to?
I'm Glenn Stevens Scherz. Unfortunately, I don't live in Lewiston. I live in Bodenham. But I come here every Sunday to sell my, probably a little more healthy than macaroons, but I sell mostly dairy products, and I do quite well. So would you like to restate your question?
That answers my question. Okay. Thank you.
Yeah, and just to add to that, I would say for some of our vendors that are either located in Lewiston or just outside Lewiston, the Lewiston Farmers Market is either their top or second best market, and that's, we do vendor surveys and are set to direct sales, and a great way to get business people to have the income go right into their pockets, which is great.
Further public comment? Back to the council for discussion. Councillor McCarthy.
Hard name to pronounce. I'm just curious, is there a fee for people to participate in the farmers market, to have a booth there, or is it just, how is it controlled, and I think it's a great idea. This is just pure curiosity.
Most farmers markets do have a fee, and it's a membership fee, and that allows us to cover the costs that, for running the market, staffing and programming. And so it's an annual fee. And then it's a voting board, it's a voting membership with a board and we just incorporated this year, so.
Awesome. Thank you.
Yeah.
Councillor Clement?
Mr. Mayor, it's February 1st, Groundhog Day is tomorrow, planting season is right behind it. Let's move the question so these folks can get to business.
Madam Clerk, please call the vote.
Is that Counselor from Ward 3?
Yes.
Ward 4?
Yes.
Ward 5? Yes. Ward 6?
Yes.
Ward 7?
Yes.
Ward 1?
Yes.
Ward 2?
Yes.
Motion passed by a vote of 7 to 0.
All right, thank you.
Sherry, thank you so much. Please tell Jenna the mayor says hi. Item number 8.
Item number 8, order to approve the new name of the former Hudson Bus parcel on Bartlett Street, which is Lewiston's new athletic facility, Mike McGraw Park. Requested action to approve the order to name the former Hudson Bus parcel on Bartlett Street, Mike McGraw Park.
So moved.
Seconded.
Councillor Jelinas, followed by Councillor Harriman. Discussion from the council? Councillor Jelinas.
Thank you, Mr. Mayor. I just want to comment on how thrilled I am about this. Mike McGraw has just been tremendous in this community and has taught hundreds and hundreds of students, and I can't think of a better, I'm just thrilled about this. This is an individual who has contributed not just, to our growing athletes, but to our students at Lewiston High School, and I can't tell you enough how happy I am about this.
Councillor Clement.
Thank you, Mr. Mayor. I concur with Councilor Jelinas. I met this gentleman some time ago. He was a classmate of my wife's. I'm not a native of Lewiston, but he has done a tremendous amount of good for the city. People come back and seek him out. I was thrilled. I hate to date her and me, but I think it was their 50th reunion that we met this gentleman, and I'm all for this. I had another name that was presented to me in the park. I won't put that up now, but that would have been a good choice. I think this one is perhaps even better. Thank you.
Councillor LaChapelle.
Mr. McGraw was my 9th grade science teacher. I only wish he was here that I could rub it into him a little bit. Mike was fantastic. He was also my son's teachers. He was my son's coaches. Mike has instilled everything good that Lewiston stands for. I think it's a great choice, and he's a fine individual.
Councillor Scott.
Thank you. So I as well had him as a teacher. He was a phenomenal teacher and a phenomenal member to our community. But I wanted to discuss the Lewiston Youth Advisory Committee. As the city council rep on that committee, I was at the meeting when the students were discussing the names and how they were going to go about deciding which names. And they had several choices to go through. And I cannot tell you how impressed I was to sit there with those kids and how vested and interested they were in ensuring that this was a good quality pick. They interviewed folks that had put in names, and they have been working really hard to ensure that this goes through and what that park is going to be for us. And I just want to say that I'm very proud of that group of young people that we have working with our city.
Mr. Mayor? If
Yes.
there's no other council, I would echo Councilor Scott's comments. I was sitting in the interviews for the final 3, and the thoughtful questions and expressions that they asked as they vetted that. I will let you know that unfortunately Riley, the council president, that rep that was here, had to leave before we could get to this agenda item. So she apologizes for that, but I at least wanted to let you know that they were here to present this directly to you.
Thank you, Administrator Hunter. Public comment? Back to the council. Councillor Scott?
Yes, just one more thing. I did not realize that that was Riley sitting in the audience. So I would just like to suggest moving forward that if we have one of our students here, especially on a school night, can we please put this forward sooner on the agenda or fix the agenda so that they are one of the first that we have, because I think that that would be appropriate.
Yes, typically we do.
Thank you.
Madam Clerk, please call the vote.
Counselor from Ward 3?
Yes.
Ward 4?
Yes.
Ward 5?
Yes.
Ward 6?
Yes.
Ward 7?
Yes.
Ward 1?
Yes.
Ward 2?
Yes.
Motion passed by a vote of 7 to 0.
Madam Clerk, am I to understand that we're on agenda item number 9?
Yes, sir. Item number
Excellent.
9, Order authorizing the city administrator to execute an assignment and assumption of contract and easement connecting the second level of 191 Lisbon Street to the Centerville parking garage. Requested action to approve the order authorizing the city administrator to execute the assignment and assumption of contract and easement for 191 Lisbon Street in a form substantially as attached relating to the second floor level walkway over Canal Street Alley connecting the property at 191 Lisbon Street to the Centerville parking garage.
Councilor LaChapelle? Councilor Pease? Open for discussion? I understand we have,
If you would like just
Jeffers?
a brief description of what's needed, I'm happy to do it, more for the public's benefit than yours, but I don't need to do it.
Councilor Herman?
I wouldn't mind hearing from, wouldn't mind hearing.
Okay, certainly. Norm Anktel bought 191 Lisbon Street back in 1987. He thought his building would be improved if he could connect directly to the parking garage. He entered into a contract and easement with the city back in 1987 for a 99-year lease that allows him to connect from his building over the alleyway into the garage directly. He has come to purchase and sale agreement with somebody who wants to buy the building. And the agreement was with the building owner. It didn't necessarily carry with the building. So the way it was structured is the city council would need to approve any conveyance of the property so that those easements and lease continue. And it's not extending it or anything else. It's literally changing the name of the LLC who owns it.
Public comment? Back to the council. Please call the vote.
Council from Ward 3?
Yes.
Ward 4?
Yes.
Ward 5?
Yes.
Ward 6?
Yes.
Ward 7?
Yes.
Ward 1?
Yes.
Ward 2?
Yes.
Motion passed by a vote of 7-0.
Agenda item number 10.
Item number 10, resolve accepting and appropriating the grant of $250,000 from the Heads Up Pedestrian Safety Project funding from the Maine Department of Transportation. Requested action to approve the resolve accepting and appropriating the grant of $250,000 from the Heads Up Pedestrian Safety Project funding from the Maine Department of Transportation.
So moved.
Councilor Herman?
Second.
Councilor Clement? Anything you'd like to say?
Yes, sorry.
Marianne?
You can tell it's past my bedtime.
Can you please state your name and title?
Marianne Brenchek, the Director of Public Works. Typically with funding coming in from the Department of Transportation, it becomes part of our budget and you don't hear it individually. But the Heads Up program is a very special program to us. We had a very serious accident involving a youth and we're very committed to pedestrian safety. So this is the first round of grants that came out about a few months ago, but because the paperwork is just getting together, we already have a new grant that we're coming back with the next meeting as well. So this is the first $250,000. It's 80% and there's a 20% match. We have that in an account already. And these two projects entail one exciting educational program with the middle school students, where they're going to design and help do some trial projects around Five Corners and in front of their building on Central Ave. They'll be very much a part of it. We've already started to do some work with the middle school teachers, so that's exciting. And then the second part, you've seen a lot of the rapid flashing beacons that for pedestrians, where there isn't a traffic signal, this is a safer area, a safer way for pedestrians to cross. So we have 3 new ones being installed at Sabattis and Oak, Sabattis and Wood, and then on Main Street in Montello. So these projects are, again, highly focused on pedestrian safety.
Council discussion? Councilor Clement?
Mr. Mayor, thank you. For the director, I think most of my colleagues here received the email from former Mayor Gilbert requesting, and I don't know whether this is something that can happen or not, whether you've seen that email.
I have seen that from
Is
him.
that something that conceivably could happen if there is an overage of funds at the end of the project?
Absolutely, and we can do that within our regular signed budget for looking at the right locations for something like that.
As long as you note that, we'd be most appreciative of it. Thank you.
My question as well.
Councilor Scott?
Thank you. I just want to say, so I was on the school committee and I was the chair of the school committee when that student passed away. And that was one of the most difficult things, but it did open up the conversation, and it really pushed the conversation about pedestrian safety and the need for pedestrian safety in our community. And I'm very happy to see this. I'm also happy to say that we're going to have students involved in the Five Corner conversation, because that was one of the biggest things that came up when we were first discussing pedestrian safety after the accident, was that particular area and how difficult it is, not only for traffic and the students, just everybody all around. That intersection is really difficult, so I'm really happy that the kids are going to be involved in that too. Thank you.
Awesome, great.
I think that in a city which probably has the youngest or close to the youngest median age in the state, and a significant portion of residents do not own a vehicle, yes, pedestrian safety is paramount. Councillor Scott, or Councillor Harriman?
That's okay. I agree completely, and I'm really excited about this. I walk pretty frequently in many of these areas, Sabattis Oak, Sabattis Wood, and near the middle school. And I agree there are definitely improvements that can be made, and I'm also glad that you're incorporating student involvement as well, because I think that's really important. Thank you.
Thank you. Awesome.
Public comment? Back to the council. Madam Clerk, please call the vote.
Counselor from Ward 3?
Yes.
Ward 4?
Yes.
Ward 5?
Yes.
Ward 6?
Yes.
Ward 7?
Yes.
Ward 1?
Yes.
Ward 2?
Yes.
Motion passed by a vote of 7-0.
Item number 11.
Item number 11, resolve recognizing and supporting Lewiston's senior community and their contributions made to Lewiston and others. Requested action to approve the resolve recognizing and supporting Lewiston's senior community and their contributions made to the city of Lewiston and others.
Councillor Pease, Councillor LaChapelle? Discussion?
Mayor?
No. Councillor Clement?
I put forth this resolution at the request of several constituents, conversations that were held last term, as well as since the most recent election. And I would hope that my colleagues will look at this and bear this resolution in mind as we move through the budget season. And let's do some things that we need to do for our seniors that we haven't done for the last 2 or 3 years due to the madness that the world has created around us. Thank you.
Councillor Scott?
Thank you. So I just want to let my fellow councilors know that I did call Administrative Hunter today to ask if there was any budgetary constraints if we were to do this resolve. Only in the respect that I wanted to know if it was going to make us, if certain budget issues come up, have to vote that way because we put this resolution in place. And she told me today that that was not the case with the wordage. I'm not bringing this up to, I don't disagree with any of this at all, absolutely not. But I would like to state that, we do have an equity statement in our city that addresses a lot of what is said in this resolve. And I did want to say that it does specifically mention age, economic status, everything that you're saying here. This does not mean that I'm not going to vote for this or agree with this. I just want to point out that we do have an existing equity statement in place. I would also like to suggest that we have a Lewiston Youth Advisory Committee. I would love to see a senior advisory committee so that we can have our seniors talking to us and telling us what it is specifically that they want and what they're doing and how we can support them. So that's all. Thank you.
Councillor Harriman?
And I just wanted to say thank you for Councillor Scott for clarifying that with the city administrator. I agree with this, and I certainly support our senior community. I just want to make sure that we're not ignoring other segments of our population, other age groups as well. I was just looking at the U.S. Census Bureau data for Lewiston and for Maine. And Lewiston actually has more residents under the age of 18 than over 65, which is pretty big contrast to the state of Maine. So I just want to make sure that we don't forget other age groups as well.
Public discussion? Back to the council? Madam Clerk, please call the vote.
Counselor from Ward 3?
Yes.
Ward 4?
Yes.
Ward 5?
Yes.
Ward 6?
Yes.
Ward 7? Yes. Ward 1?
Yes.
And Ward 2?
Yes.
Passed by a vote of 7-0.
Item number 12.
Item number 12, appointments to the Planning Board and Lewiston Area Public Health Committee. There are 2 items for requested action. The first item is to approve the mayor's nomination and to appoint Lee Albert to the Planning Board, term to expire January 7th, 2025.
Separately? Okay.
Are we taking them separately?
Yes,
Oh,
separately.
sorry.
Yes, thank you.
So moved.
Seconded.
Councilor Jelinas, Councilor Harriman. Discussion?
Mr. Mayor,
Councilor LaChapelle?
at this point, I move that we table this nomination until we have the full slate of members to go on the planning board, or however the proper wording should be, Madam Clerk.
Sure, right, so to postpone action on this matter until the, basically the other vacancy also has a nomination as well. Is that
Correct.
essentially? Yes.
Correct.
Thank you.
I would second that motion.
Call the vote? Or
Sure.
is-
So just for clarification, so the motion is to postpone action on this matter until the other nomination is presented to fill the vacancy. I do believe Councilor Harriman may have a question on the pending motion.
Yes, please, Councilor Harriman.
So any comment is limited to just the motion, not further discussion?
Correct. The immediate motion before you, which is the one I just read about postponing the matter. Yes, sir.
Would it be germane to just say that I think that the planning board should, we should get one person in place and then.
Out of order, Mayor.
So it really is pertaining to the
Just the motion.
postponement of
Yes,
it.
just the motion at hand.
Okay, I apologize.
And the merits of that motion.
I apologize.
Madam Clerk, please call the vote.
Counselor from Ward 3?
No.
Ward 4?
Yes.
Ward 5?
Yes.
Ward 6?
Yes.
Ward 7?
No.
Ward 1?
Shouldn't vote no.
No.
Ward 2?
Yes.
Motion passed by a vote of 4-3. The next item on that same agenda item, Mr. Mayor, would be under item 12, number 2, to approve the nomination submitted by the Lewiston Area Public Health Committee and to appoint Nina Gargan to the committee term to expire December 31st, 2024.
Mr. Mayor.
Second.
Councilor Clement, followed by Councilor Jelinas. Discussion? Public comment? Back to the council? Please call the vote.
Counselor from Ward 3?
Yes.
Ward 4?
Yes.
Ward 5?
Yes.
Ward 6?
Yes.
Ward 7?
Yes.
Ward 1?
Yes.
And Ward 2.
Yes.
Motion passed by a vote of 7-0.
Item number 14?
Item number 13, actually, Mr. Mayor, reports
Oh,
and
item
updates.
13, correction, thank you. Reports and updates? Councilor Scott.
Oh, my goodness, I'm not sure can you hear me? I feel like it's not even working. Okay, sorry. I just wanted to touch upon a couple of things that the school committee discussed last week. We did have a request from our Restorative Justice Club, who came and spoke publicly about us looking at the policy around standing for the Pledge of Allegiance. This was something that was requested to be put on the agenda, and at this time, when looking at the policy, it's not been discussed since 2012, so I think that we're going to look at the policy, but I don't see there being any big changes at this point, but I can't say that specifically. But we shall see in the future how that goes. We also had a discussion about putting Narcan in training in our schools, which I thought was a phenomenal idea, and I appreciated that we had that conversation earlier this evening. This would be training for nurses and our administrators, and it's unfortunate that we have to have that conversation, but we have defibrillators in our school, and Narcan can save a life, and I think it's really important, and I'm glad that we got a unanimous vote on that to be put through. Yes?
Let me ask a question.
Councilor Julianis?
So curious, I read the article about that, and that was great, Councilor Scott. I did note that the training for Narcan administration was sort of limited to administration and health professionals there in the school. And I'm just wondering if that is also the case for the defibrillator that we have in the schools. Is it just the administrators and just the healthcare professionals?
On the defibrillator, I believe that it's offered to others as well if they want to do the training, and I know that the discussion was put out there also to offer the Narcan if others were interested, particularly like some of our coaches and stuff like that. It was more, the thought process was around at a football field, if something happened there, we need to make sure that we have, if it's an adult and not a child, we need to be prepared for that like we would with any other situation. That's all I have at this time. Thank you.
Councilor Clement?
Mayor, if I might direct a question to Councilor Scott. The policy on Pledge of Allegiance, that does not require participation, but it does require that they show respect.
So the current policy that's currently in place, and the question that's really being brought up, is the permission to not to have to stand if you don't want to. And that there is wordage in that in our current policy that says that, but nationwide and in many other school districts, there is no permission needed. You do still have to respect the flag. There still will be a flag in a classroom, and the Pledge of Allegiance still will be said. This just gives the First Amendment's constitutional right that if you don't want to participate, you don't have to, and the conversation around not having permission, having written permission in place if you don't want to.
Well, I guess I would encourage those students who are partaking of the great educational benefit they give this country to show respect for the country that gives that to them. I don't have a problem with their constitutional right to say whatever they want to say within reason. Don't shout fire in a crowded theater, but I would hope that there's some modicum of respect. We see it on the national level. We see it in sports and stuff like that right now. Quite frankly, my background, it disturbs me to see that happen. I mean, America, in my way of thinking, is the greatest country in the world, and we should show respect for it. I thank you very much.
I appreciate that comment, and I will let my fellow counselors know that I am on the policy committee as well for the school committee, so I will be directly involved in this conversation, and I'll keep you posted.
Thank you.
Appreciate it. Thank you.
I have a couple updates. Dottie, what is Dottie's title?
Community Relations Coordinator.
Thank you. Yes, Dottie, our Community Relations Coordinator, had emailed me a while back and wanted to know if I wanted to continue with the Youth Poet Laureate. And my response to her was, poetry is needed now more than ever. But we've kind of like revamped things just a little bit, kind of expanded it. And so going forward, we will have a writer in residence, an artist in residence, and a musician or vocalist in residence. And we'll be taking applications from Lewiston High School students. And hopefully very soon I'll be able to bring that back to the council for a resolution for those three. And I think this further highlights our high school performing arts center, and I'm really excited about it. Arts in a community is what makes it great. And then my second update is I had occasion to take an implicit bias test and a self-reflective assessment with Director Hugh, our diversity, equity, and inclusion. And Administrator Hunter, am I to understand that this test is being given to some of the staff now?
It is in the process of being rolled out and developing a procedure with it, yes.
So as the mayor, I just jumped in line. And it was eye-opening, and I would encourage counselors to I'm not sure of the mechanism for this, Administrator Hunter, but I would encourage all counselors to participate.
Any counselor that wishes to take it can schedule an appointment, and we'll make it happen.
Councillor Harriman?
Yeah, I was excited when I saw the mayor's post on Facebook about that training, or about that test and reflection. I've done a similar thing, not in any sort of formal way, but just, you know, I found it through a book and found the resource online, and it was very eye-opening and gave me a lot of insight, and I would definitely be next in line to jump at that opportunity, and I hope all of my fellow counselors will do the same.
Councillor Scott?
Sorry, I just thought of one more thing. I think we should promote the sledding next weekend, which is the 12th, for the new hill, and the opening ceremonies and the ribbon cutting and the new naming of the park. And I hope everybody's going to go. I plan on being there. I plan on going down that hill, so I'm bringing my sled.
I'll push you myself.
Okay.
And that event begins at 1 o'clock. So that's February 12th at 1 o'clock.
Any further updates?
No, but I think
Councillor Pease?
Scott wants you to pull her up the hill, not push her.
Well, that would be better. Thank you. Thank you, Councilor Dees.
I will take that recommendation, Councillor Pease. Thank you. Next agenda item?
Next item is item number 15, executive session pursuant to Maine Revised Statutes annotated Title I, Section 405-6A, to discuss a personnel matter. Requested action to enter into an executive session pursuant to Maine Revised Statutes annotated Title I, Section 405-6A, to discuss a personnel matter.
Councillor LaChapelle, followed by Councillor Pease. We'll be entering into executive session, and do we need a motion to adjourn?
We just need a quick vote.
Yeah, a quick, please call the vote.
Yes, Counselor from Ward 3?
Yes.
Ward 4?
Yes.
Ward 5?
Yes.
Ward 6?
Yes.
Ward 7?
Yes.
Ward 1?
Yes.
Ward 2?
Yes.
Motion passed by a vote of 7-0.
That concludes this meeting. We're entering into executive session. Good night, Lewiston.
Mrs. Calabash.
Good evening and good night.